Okay, gonna do something a little different here. This is something I'm gonna start about talking about medicine and my experience in it, just some general observations that I've learned. I'm always kind of interested in talking to, like, we have like medical scribes in our emergency department. Those are people who basically type in data information and help the doctor. I actually don't use one, but they're around a lot. And if you go to your doctor's office, you may see them. And I like to talk to them about what their perspectives are on medicine and what are the things that they've learned, the things they were surprised about. It's super interesting. I'll make that a completely separate topic. But for today, I'm just going to talk about whether you're a student in high school or in college, whether you're pre-med or not, whether you're thinking about becoming a doctor, whether you're in medical school or a resident, or you're looking for a doctor. Let's talk about the three elements that I've observed that makes a great doctor. Okay, and they may be a little bit surprising to you. Okay, I'm going to start from the least important and go to the most important. Number three, okay? Of course, the perception is you need to be a genius to be a doctor. Maybe not quite a genius, but you need to be in the upper echelon of intelligence. And to some extent, that is true because there's a lot of information that you need to synthesize, a lot to remember. You need to, some things you just really, even though in this computer age where you can look up everything, you need to have a vast store of knowledge, right? And you need the ability to kind of be able to take that in and pretty quickly file it away and kind of be able to access that memory. So you need a minimum amount of intelligence. You do not need to be a genius by no means, but you need a high capacity to process information, remember it, file it away, and kind of get to that information. Okay, so there's a minimum amount of intelligence you need to have. And I would say number three is just you need to be a pretty smart cat, pretty intelligent, not a genius. Okay, number two, empathy. I don't know, I was really torn about putting this number one or number two. It's really more like a 1A or 1B situation with the what I'm going to list as number one. But empathy is just extremely important. I mean, you can not know something, and that's sort of fine. You can ask somebody else, you can look it up, right? You can even be a dumbass, really, kind of. I mean, that's not fine, but at least you can send a person to someone else who knows better, right? You can refer a person. You can be like, I don't really know about that. I can send you to another doctor that does know. But if you don't give a, this is the wrong profession for you. If you're the type of person, in my opinion, that can watch videos of people falling off of things and getting injured and laugh at them with no empathy, you probably shouldn't be a doctor, right? Empathy. Okay, all right. Number one. The number one element a person needs to have to be a great doctor is academic curiosity. Okay, this is so important. I can't emphasize how important this is. And it's more rare than I like to say or admit to, or anybody would like to think about. In my mind, this probably comes from the fact that being a physician worldwide is a pretty prestigious occupation. It's not always the most well-paid job, especially depending on where you are in the world or what you decide to practice. But in general, if you're a physician, it's a noble occupation, right? It's something that people look at as like, okay, you have to have a minimum amount of intelligence, you have to pay for it, in most countries, you need a certain amount of wealth in order to even pursue it. And if you have those type of smarts, you're elected to use them, to try to help people in general. So people kind of look up to that. So it's a sort of profession that a lot of families, their child is relatively smart. They're like, hey, you may think about being a doctor, and sometimes that gets projected onto people. And just because you're smart and you're smart enough and have the work ethic and the drive and the motivation to become a doctor, and you carry that all the way through, does not mean that you actually love science or medicine, right? So I think that's where we see a lot of people that become physicians and then they just stop learning. They pretty much just do what they were taught in medical school and residency. They don't continue to grow. They don't continue to follow the newest research, the newest literature, the newest practices. They have to almost be forced like their hand, to get into, okay, we're not doing that anymore. That's not safe anymore. This is the new thing. This is what's going to help people the most. And that's not something that happens if you're academically curious, right? If you're academically curious, you're interested in what's new, what's coming out, what people are talking about. It doesn't mean you change your practice right away. It just means that you kind of, you're looking at what's changing, what's the new thing, what are we learning, what do we know now that we used to do, and now we know it's dangerous or it's hurting patients or it's not helping them, that we can stop that and we can do this new thing, or just completely not do the old thing at all and just leave it alone. It's going to get better on its own. There's so many things like that in medicine. And if you're not academically curious, it's just impossible to become a great doctor or even a good one. So academic curiosity, to me, would be the number one element you have to be a great doctor. Academic curiosity, empathy, and intelligence. Don't forget to subscribe to be notified when we drop new Dr. Keith episodes. And please post any questions you have about this episode or any other medical questions in the comments.